Well, the present role of fungi in infectious disease is controversial, actually, because fungi are normally pathogens for patients with compromised immunity, which means with a reduction of the defense against infections. And there are many fungi that can be pathogenic for humans, but the main important pathogens are Candida and Aspergillus. Candida is usually causes bloodstream infections and is particularly a problem for patients hospitalized in intensive care units and in internal medicine departments, in hematological departments, and is basically recently the role of Candida infections in internal medicine departments has been increasing because of the changing type of patient that is hospitalized in internal medicine wards right now, which is very old, elderly people with a lot of comorbidities, with diabetes, with people that survived many other problems, many other medical problems, which is the typical type of patient that we see right now in our hospital. Because it's the result of the progresses of medicine, basically. Candida is susceptible to several antifungal drugs. We have basically 4 families of antifungal drugs, and Candida is susceptible to almost all the 4 families, although there are differences Candida by Candida, species by species, in terms of sensitivity or resistance to some specific antibiotics. The burden of Candida infection is a big one, because Candida is from the 3rd to the 5th more frequent pathogen isolated in blood culture, in intensive care units, internal medicine units. So it's an important pathogen. The other important point associated with Candida infection is mortality. Mortality is very high. It's a crude mortality that can reach something like 50%. It depends very much on the underlying condition, because the crude mortality doesn't take into account the role of the underlying disease, which is of course very important, because these patients, as I said, have multiple comorbidities, are hospitalized in intensive care medical units, so they have a lot of problems. And Candida comes on top of many other problems. The other pathogen that I would like to talk today is Aspergillus. Aspergillus is a completely different type of, it's a fungus, but it's a completely different type of fungus, because Candida is a yeast and Aspergillus is a filamentous fungus, and it's a completely different type of disease. It causes pulmonary diseases, particularly in patients with hematological disorders, malignant hematological disorders like leukemia, or people undergoing bone marrow transplantation, or with lymphoma, with undergoing organ transplantation. Aspergillus doesn't cause bloodstream infections, like Candida, but causes pulmonary infections. And it is also a big killer, because the mortality associated with Aspergillus infection can be very, very high. Also in this case, of course, is a crude mortality, because we have to take into account that this patient very often has another underlying disease like leukemia, or a solid tumor, or a lymphoma, and therefore there is also the role of the underlying disease. But there are patients that can die from Aspergillus infection while in remission of their underlying disease. The spectrum of antibiotics, of antifungals available for fungal infection for Aspergillus is smaller than that for Candida. We have voriconazole, posaconazole, amphotericin B. But for example, the echinocandins that are very active against Candida are not very active against Aspergillus. The treatment is very difficult, because it's from acute to subacute disease, and it's a The diagnosis is also very difficult because while Candida grow easily or relatively easily, but grows in blood culture, Aspergillus does not grow in blood culture. So for the diagnosis, we use markers, which means antigens that the Aspergillus, while growing in the blood, release into the circulation and can be detected by making particular types of tests, like the search of galactomannan or search for the glucan test. The glucan is useful for Candida as well. So this is in 3 minutes what I can say about fungal infections. Of course, we do meetings. There will be in the next month. There will be the team meeting, Trends in Medical Mycology. That will be 3 days about fungal infections. But in 3 minutes, this is what I can say.